The penile implant procedure is one of those surgeries where the patient gradually improves over time. The patient's condition is different after 1 month from the operation, and it changes again after the 2nd month, the 3rd month, 6 months, and even after a year. The penile implant procedure is one of those surgeries where the patient gradually improves over time. The patient's condition is different after 1 month from the operation, and it changes again after the 2nd month, the 3rd month, 6 months, and even after a year. The longer the time passes, the more satisfied the patient becomes. Today, in the first episode of the 2nd part of the penile implant program, as we agreed to name it satisfaction, we'll talk about the first reason that may lead an implant patient to be dissatisfied after the procedure. The first reason is the rush for results. In other words, the patient may be impatient for the outcome. The penile implant procedure is one of those surgeries where the patient gradually improves over time. The patient's condition is different after 1 month from the operation, and it changes again after the 2nd month, the 3rd month, 6 months, and even after a year. The longer the time passes, the more satisfied the patient becomes. The book advises not to ask the patient about their opinion on the operation until after a full year has passed. Many patients may come after a month or two with some observations. Whether these observations include slight pain, tingling in the organ, partial loss of sensation, or dissatisfaction in relationships. After 2 or 3 months, they may say, "No, doctor, the situation has improved a lot." After 5 or 6 months, they come and say, "No, the world is much better now, and I feel a huge difference. I feel like I'm back to being a young man of 20 years old." So, one of the most important reasons that can make the patient dissatisfied is being impatient for results and wanting quick outcomes. Imagining that the first sexual intercourse after the procedure will be the best. No, the first time is different from the 2nd time, which is different from the 10th time. The longer the time passes, the more the patient's body adapts to the penile implant. As tissues heal, any pain diminishes. If there is inflammation in the nerves, it disappears. If there is an issue with ejaculation, it improves. Psychologically, the patient forgets that they had the operation, so they stop focusing on their performance during intercourse. Many things change significantly over time. Advice I would give to any patient feeling dissatisfied during the procedure is to be patient, not rush, and avoid making fast decisions. Because what you're feeling now may disappear over time. Throughout our lives, we have seen many patients who, after a month or two, become distressed. Sometimes they even reach the point of saying, "Take this implant out. I'm not happy, I'm not comfortable. It's causing me pain, it's causing me discomfort." The same patient comes after 5 or 6 months saying, "Thank you so much for not listening to me and removing the implant. It was an excellent procedure. It's the best thing I've done in my life getting this implant. I'm glad I didn't rush and have it removed." The truth is, whenever a patient comes and asks to remove the implant after a month or two, we don't respond to it immediately. Instead, we try to convince them to be patient for a while. And indeed, with the passage of time, they feel significant improvement. So, advice to every patient with a penile implant who is not satisfied: firstly, be patient for a while. With time, all your concerns will gradually disappear, and you will feel that the best decision you made in your life was to get the penile implant.